You're welcome back. This is Newsfile, it's your most authoritative news analysis platform. Yakubu Ibn Chambers is sending this message and says that let the authorities do everything possible to help victims of domestic violence rise from the depth of unbearable despair. Confronting the darkness of gender violence requires a hydra-headed approach from multifactorial angles. It is not as simple as we think. When the impunity happens, authorities must find opportunities for victims and punish perpetrators. It must be treated as a pestilence because the statistics are chilling. Yakubu Ibn Chambers sent in that one. Erastus Donko, you know him, he says that 2 years after I did a report on child prostitution in Kumasi, I went back last week and the numbers are rising. Children from as low as 10 years old. The areas include the Asafo area, popular places. But now he says he's seeing some at Plaza, Dichemso and Abinchi. Okay, I'm familiar with these places. The guys here, some were telling me if we're aware of the immediate environment here, circle areas, small girls just begging men for 5 cedis, 10 cedis, offering themselves. That's very disheartening. Now, this is from Ochre Dako Ubuntu. He says, another thing government can do is to make the offense of rape triable summarily. As it stands now, rape is a first-degree felony and it occasions delay in the prosecution of such cases. Second degree, I suppose, right? Okay. Collins Little Tete says rape culture allows sexual violence to be normalized and justified, fueled by the persistent gender inequalities and attitudes about gender and sexuality. Naming is the first step to dismantle rape culture. Biases that permit rape culture should not continue. MD Eshrain says, I think there should be a live recording of hospital transactions, and these transactions should be tagged. Okay, the tags will trigger an automatic report to the police when it is one which has been flagged by police. The transactions will have the details of the patient. Emmanuel Ejebequin says, I agree with Professor Akosia. We are so embarrassed by the statistics regarding the porn thing and tend to be dismissive, giving funny defenses. How do we even juxtapose those stats over our religious nature as Ghanaians? The religious hypocrisy is nauseating. Akwezua T, is that your name? Okay, Akwezua T says that it's pathetic to see as young as 12 years old pregnant and okay, they are about to deliver. If you ask this girl what happened, she says she was raped. Okay. Then you ask the mom, why didn't you report to the police? She says she wasn't raped, but consensual. Okay, so that's part of the problem we have to deal with, you are saying. Right. The Vodafone helpline just reach out to us and to let us, Dr. Edward Addo understand that your patient has help. So they are going to take full responsibility and help your patients. So we have ACT Foundation and Vodafone helpline coming through. these are questions being asked. What help is available for survivors?
Okay, thank you very much. When it comes to addressing issues of domestic violence, you need more than one agency or institution to do that. And so for police, what we do is that we do the criminal aspects in terms of investigations and prosecution. And then we reach out to other institutions who are able to provide the necessary assistance. So we reach out to counselors, the hospital, we reach out to NGOs who have shelters or who can provide some funding for us to book a guest house or a place of safety for these people. So beyond us, we are able to reach out to other institutions. Now, the issue of, we realize that, for instance, when it comes to rescue, it becomes difficult for us. Or sometimes when the victim herself or survivor herself is able to reach us on our premises, it becomes an issue as to where to even put the person. Because you don't have, state shelters around. We depend on NGOs, sometimes as late as 9 p.m. So what we've decided to do, the police administration decision going forward, and even currently, is that we've set up our own temporary shelter within our one-stop center. So now this one-stop center is indeed truly a one-stop center, and I invite all of you, the panelists, to pay a visit and have a look at the place. It's truly one-stop center where the survivor enters and everything the survivor needs is in that building.
What do you mean by that?
What I mean, everything. What therefore I mean is that the person is going to receive medical care. So the issue of paying fees, endorsement fees, and all that.
You have a hospital within it?
Yes, in fact, we just set up the clinic yesterday. The consultant came to set it up. Now we have some money to start the lab. We're going to have a lab, and the lab will do a lot of things. It will include forensic. It would include DNA testing, COVID testing, because when you need to rescue, after rescue, you need to put somebody in a shelter. You need to be sure the status. And then for also the normal basic lab, when you go to the hospital, you need to do. We have 2 courts. For the first time in our history, we have courts on police premises. So in that building, when your case is done, or we have cases from other police areas in relation to GBV or domestic violence, you come to that court because it's going to be a domestic violence.
So you have 2 courts?
2 courts, district courts and a circuit court.
Okay.
And judges will be there. It's not like they come on maybe days, but it will be the 5 days that judges sit, Monday to Friday, the court will run. We have also a place where we interview children. It's child-friendly. It's been designed mainly to interview children. And it is such that we also would avoid secondary victimization, which it's what it is now, is that when you move from police to, let's say, the hospital, you have to repeat your story. From the hospital to social welfare, you have to repeat your story. Now we've set
That's
up
what you call secondary victimization.
Secondary victimization.
Okay.
So now we've set up the system in a way that as you are interviewing the child or the adult, the doctor sitting in his clinic, in his office within that same building, is able to monitor the conversation. He will then take the history, so that when the child or the adult comes to the doctor in his office, the doctor, all that the doctor needs to do will be to introduce himself and say, I am Dr. Blah Blah, and this is what I'm going to do with your body, so that you don't have to repeat the story. So we also have counselors on site, we have social workers on site, we also have lawyers on site, so that some of the issues, there are civil aspects, legal aspects that they need some service of a civil lawyer to take up. So we have lawyers there to look at the civil aspects of it, while we also deal with the criminal aspect. And then we have our court is a child-friendly court. So the child has a waiting area, waiting to give evidence.
This is your initiative.
Yes.
As the police.
Yes.
DOFSU.
Yes. Yes.
This is just Accra you're talking about.
Yes. So we have rolled out a plan to go beyond Accra, and not just the regional centers, but also down to the division, the district level. There are strategies, but of course we need help from the general public, because to put this together, it's it's capital intensive, but
so
of
when
course,
you say help, you mean finance?
Finance,
Okay.
yes. We need funding. So we've been going out for fundraising, reaching out to individuals, corporate world, and all that to come on board. And in fact, we have visitors coming from other countries to look at it. And ours is the most unique and the biggest in Africa.
This is very new.
Very new. It has not been commissioned.
Okay.
But of course, people have heard about it and people have started coming in. So we started receiving cases, but we are yet to land it. And then we have a helpline center within that building.
Right.
And the helpline center is such that when you call, we are able to connect you to the appropriate personnel that you need.
So you say you are going to try to replicate this?
Yes, there are plans to do same. We are going to start, I mean, once Accra is commissioned, we'll move to another region and start the same structure there, and then we move on. I mean, there are strategies to see if...
But like you said, you are depending on people's benevolence to do this.
Exactly.
So it depends on what comes in.
Yes, it depends on what comes in. But at the same time, I mean, with time, I'm sure the administration will pick it up and also see how internally they can also assist in terms of funding.
Vodafone Helpline, who just came to the aid of Dr. Ado's, patient, I'm sure that corporates like that are watching, they are listening.
Yes.
The MTN Foundation and the rest of them can reach out.
In fact, just quickly, just to mention, in fact, we have those who contributed so far. We have the Australian High Commission supported us, and then we have Casa Precon also came in to support us. We have Latter-day Saints, we have individuals. UNICEF also came on board to do the child-friendly courts. They funded the whole court. So we have donors and other companies.
Yeah, the Domestic Violence Victim Support Fund. So, of course, we were supposed to have the gender minister on this show to assist us to give some direct answers to some of the issues that have come up because they are within her jurisdiction. And somehow she's unable to join us. Don't know why. But in 2011, when the board was set up and the fund started to operate, the seed money, 50,000, from my understanding, is that 50,000 is long depleted. So what's happening to it?
Honestly, I'm unable to speak to the DV fund. I mean, I'm sure the best person to speak to, or it should be a rep from the Ministry of Gender. I know it's been set up and people can assess. For instance, the lady who talked about who was defiled at age 13 and currently has issues could reach out to the Ministry of Gender and see if there is something that they can get for her.
Forgive me. Lamnatu, what would you like to say finally in respect of solutions? In some 1 minute, 30 seconds, what can you say?
Thank you, Samson. Probably I want to say that we need to have this conversation again. But then, not just here, we may have to create other spaces for citizens to get engaged. Like I think one of the contributions we had, this is multifaceted. We need to bring on board traditional authorities. And I think that we shouldn't forget of the child and family welfare policy, which entrusts the protection of the child into adult and other structures within the community. For me, I think that I wanted to hear more about the DV fund because all of this will get a response through the DV fund where victims can get support. But I would like to also call on the Ghana Medical Association to try and waive these charges. I mean, listening to Doctor today, just knowing that it's just about attending to court. That's why, I mean, they should try and waive it. Because looking at the situation of this vulnerable person who has been defiled or who is hurt, and for the person to go and again to pay this charge, it means a lot. I think they should just see it as part of philanthropy. They should. I think I've seen that some other people are doing it. Right. And for the DV unit, I think that they should look at other ways to get funding to support them.
Well,
and
thank
government
you.
should look at the COVID fund. Samson, allow me to say this. The COVID fund should be used to support these girls because we're trying to get them go back to school, like the GS re-entry policy, but a number of them want to learn a skill. And there's so much burden of having to take care of the children that
Thank you so very much. We hope that the duty bearers have been watching, they have been listening, and they have taken notes accordingly. How time flies. I was hoping we could come to you all to give us just a word to conclude, but time just ran out. Thank you all so very much. Professor Akoto-Ampaw is at the School of Law, University of Ghana. Professor Akosia-Dakwah is sociologist, also at the University of Ghana. Dr. Akoto-Ampaw is a medical director at Eastern Regional Hospital. Lamnatu Adam is executive director, Songtaba, an NGO in the Northern Region, and Chief Superintendent Owusu Treme is director of DOFSU. My outfit, as always, is by Havels Couture. They are at Adringano Gate, East Legon. You can call them 0200 84 1988. 0200 84 1988. Thank you so very much. Have a good afternoon.